upwards of 40% of the people that are intubated in our ICUs with COVID are people of color. And that is not the same percentage that we would typically see within our ICUs. You would be struck by the fact that if you were to ask what neighborhoods and towns they come from, they disproportionately come from a small number of neighborhoods, of cities and towns around the state, and are not spread equally across this state. And we know that that's true for a number of reasons. First of all, these are people that don't have the luxury of, many of them, for their jobs to use Zoom and work from home. They need to go out into the workplace and are exposed that way. We know that people of color have what we call comorbid illnesses, things like cardiovascular disease and diabetes and other things at a higher level than others that puts them at risk. We know that what happens with transmission of this disease is it's really important to be able to isolate if you are sick. Well, if you have a big house and you get sick and a family there and you can close off a room and a bathroom and say, I'm not going to be in contact with anybody else, that's great. But if you live in a small apartment or a multi-generational home, you can't do that. And we're seeing the result of that. Shouldn't surprise us, actually.